Greetings, fellow alumni. We are here at Rose Alumni House, and we are excited to be shooting Season 2 of Yale Afternoons with Alison, a series where we bring university leaders to Rose Alumni House to talk about their priorities and alumni engagement. Today, I'll be sitting down with Ranney, Dean of the Yale School of Public Health, the CEA Winslow Professor of Public Health, and Professor of Emergency Medicine. Dean Ranney.
Alison.
Welcome to Rose Alumni House. We are so excited to have you here.
Thank you. I'm thrilled to be here.
This is going to be a great conversation.
I'm looking forward to it.
You're doing amazing things at the School of Public Health, and I'm excited to dive into those things.
Thank you.
But let's talk about that first.
Okay.
Let's start. There's a lot of change happening at the School of Public Health since you become dean. So why don't you give us like a quick refresher of what's going on before we dive into your priorities and where alumni can help you.
Sounds good. So in 2022, the corporation voted to make our school independent for the first time in its 100-plus year history. Although we were a school, we were kind of a school in name only. And so with that vote, they then recruited me here to split our school off, to do a spin-off of sorts from the med school. And to really take us from very good to absolutely outstanding. To launch the school as an independent entity, to retake our place as really not just national but also global leader in public health.
So what does that mean, global leader in public health?
So it's a few things. I'm actually going to go back and say in the 1910s when our school was founded by a guy named CEA Winslow. I'm lucky enough to hold his professorship. He defined the field of public health, not just for our country, but for the globe. I'd argue that we're at a point where, although that old definition of public health still holds to some extent, it's a time for us to rethink how we do the science, how we translate it out into community, and how we're training generations of leaders in using the discipline of public health to change the systems and structures that keep us healthy or that make us sick. And so we're thinking really deeply about how do we think about healthcare systems in this moment? How do we think about environmental drivers of health and get those changes out into the world to keep us healthier? How do we think about nutrition, infectious disease, and redefining the way that we do that science and how we get it into the hands of communities?
Well, you obviously made a choice to come here, so you think that that can happen here at Yale? So why don't you tell us what brought you here and how Yale is going to help you achieve that goal?
So I came here after 20 plus years at Brown, really for three reasons. The first was the independence. I love higher education, and having a change mandate is a relatively rare thing in higher education. So that was really exciting for me to come into this already great school and take it up to another level. The second part was Yale itself. I'm going to say that what we're able to do here is something incredibly unique and special. Public health is an interdisciplinary field. Although we have certain ways that we do science, we don't do it in isolation, right? Public health works with architects and artists and businesses and musicians and economists. And the way that the Yale campus is structured and just the whole ethos of Yale not just makes that kind of interdisciplinary work possible, but it's baked into the fabric of this place.
I love that.
And so we are able to do something here that is so special and unique, and that can then serve as a model for folks across the country and across the globe. It allows better scholarship, but also better education and practice. And then the third thing that brought me here is the moment that we're in. I mean, I came here, a little over 2 years ago. We had come out of the COVID pandemic at that point. And I don't think there's anyone in this country that would say that the way that public health was working was ideal. I think that's even more true today. And that's both a crisis, but also an incredible opportunity to define what we want the future to look like and then create it.
I love that. That's beautiful. Well, then let's dive in. What are your top 3 or 4 priorities, or 5, as Dean of the School of Public Health?
My top priority is making it possible for everyone within the school to do transformational science, education, and practice.
Okay.
We've articulated a new vision for the school of linking science and society, making public health foundational to communities everywhere.
Okay.
And everything that I do is in service of that vision.
I love that.
Thinking about how we link together the science that we do with the society in which we live.
Okay.
Thinking about how we take this amazing discipline of diagnosing health problems, evaluating root causes of health problems, and then creating solutions that work and putting them in practice.
Okay.
Thinking about how we do that more efficiently and effectively.
Yep.
And how we do it truly for communities everywhere. In New Haven, in Connecticut, across the country, and across the globe.
Wow. How do you, for people who are like, okay, I get the general concept. That's the macro. Talk a little more micro, like what does that look like to the average person?
Yeah, so if I go from the 30,000-foot view down to the 10,000-foot view, we've got a bunch of initiatives that are already underway at the school underneath that strategic plan.
Yep.
I'll highlight a couple of them.
Yep.
So one is we're working to enhance our civic engagement.
Okay.
We have a really strong program already of working with New Haven and Connecticut legislators, other elected or appointed officials to help translate evidence into action.
Love that.
And we're building that out to help turn science into real community level change. That's one example. A second example is our work on public health data science and data fairness.
Okay.
We have a whole program that we've built out to expose our students to the latest and greatest in AI and data gathering and data analysis, but also to define the terms with which we're using these new data tools to advance health for all populations, regardless of geography or demographics or ideology, right? How do we actually use data to advance health for all? And then a third example is around education. We are thinking differently about how we provide professional skills services to our students.
Okay.
We're thinking differently around the organization of our master's programs.
Okay.
We have 800 students, Alison.
Wow. Okay.
Yeah.
I don't think most people would know that.
Yeah. So about 50 of them are undergrads.
Okay.
We have a 4+1 program.
Yep.
Most of the remainder are master's students, and about 100 are PhD students.
Wow.
So we're thinking about how we create community amongst them and with our alums, how we make sure that they're prepared to go out and lead in the world.
Yes. So how can alumni help and assist with these priorities that you've talked about?
So I'll split that into two groups.
Okay.
There's my alums.
Okay, so public health alums.
Public health alums, we've got about 8,000 of them.
Okay.
For those alums, it's, hey, we're independent now.
Yeah.
Come link back with us.
Yeah.
Link with our students.
Okay.
Join alumni events. Be part of our community, mentoring our students and engaging in professional development.
We have a tool that can help with that.
Ooh, tell me.
So we run Cross Campus. It's an online community with a really strong mentoring component. So if we can get your students on there indicating that they're public health students, and we can get more alums to come back and sign up, we can help you to pair them either by specialty or area. But we would love to be a partner in helping you to accomplish that.
Terrific. Consider it done. I'll start telling all my students to sign up.
Sign up for Cross Campus.
And then for alums in general, both ours and kind of the Yale alums in general, you know, there's a couple of things that I see as really important. The first is financial aid. Our students graduate with the highest debt load of any students at Yale. So for those who are interested in supporting financial aid, that's huge, and that's a huge priority of mine. Is supporting those students. Many of them don't go on to the world's highest paying jobs. They go into public service. And so I'm trying to bring down that debt load. The second thing is thinking about networking. Yale alums, college, School of Management, law school, School of Architecture have been incredibly generous already. As I connect with them and thinking about internships, mentorship, I'm excited to network our students in with the larger Yale community. So those would be two big things. And then the third is just come say hi to me.
I love that.
I love meeting the folks in this community. People are so smart, kind, determined, creative, and I just love learning about what everybody's doing.
Okay.
I think, we need new ways of thinking and acting, and the best way that I know of to innovate is by hearing ideas from lots of people and then mashing them together in new ways.
Yeah.
So each time I get to meet our Yale alumni community, it brings me energy, gives me ideas, and often results in new things within or outside of our school.
So I hear a couple things. I hear you're very willing to be a Red Path speaker and go
Yes.
out to our regional clubs to meet more of our alums. So thank you for that. I know you've done a few of those, and we're excited to get you on the road even more. But you also want to know when alumni have opportunities, even if they're not in the School of Public Health.
That's right.
In their areas of expertise, where partnering with your students could be really helpful.
Those are both terrific takeaways.
Okay, I love it. So can you highlight any alums who have done some of this exceptional work on your behalf?
Oh, we have an incredible group of alums. So I'm going to highlight one, KP Paula, degree from our school.
Yep.
Met his wife here. She's also a YSPH grad.
Love it.
Went off and led entrepreneurial initiatives globally, thinking about how you use technology to enhance the health of populations in sub-Saharan Africa as well as in the U.S. And now has come back to the school as a senior fellow.
Oh, cool.
And is leading our programs around entrepreneurialism and public health, creating connections with Yale Ventures, teaching a super cool new course for our students. He's just, I think, epitomizes that Yale ethos of linking light and truth, and has given to our school in so many ways.
That's amazing.
And continues to lead within it.
That's awesome. I just love everything I'm hearing from you about all the ways you're reaching out into the broader Yale community. That's something that we're trying to do here in the YAA, is not be an island and really showcase to university leaders and university partners that alumni are here to help you solve problems. So bring your challenges to us so that we can mobilize this 190,000, person force really that can solve problems, well beyond just alumni matters.
As you say that, Alison, it actually makes me think of another way that alums can help.
Yeah.
So one of our strategic priorities is around recreating trust in science, and particularly in the science of public health. It is something I personally have been spending a ton of time on. My whole career is marked by bridging perceived divides. I work a lot on firearm injury prevention in both rural and urban areas. But on a school-wide basis, we've got a bunch of initiatives to try to translate the science out into terms and little nuggets that communities across the country and across the globe can use. And so one thing that alums could do to help with that, actually follow our social media. Our Instagram, TikTok are, I think, pretty terrific, but also provide these tidbits that you can use. But also then engage, thinking about how the alums can bring public health knowledge and science into their own community to solve their own health problems. Consider us a resource. Whether your community is facing challenges around gun violence or around school start times or around adolescent mental health or loneliness or the effect of climate on health. We have resources on each of those. Please use those.
I love that.
To inform your own community's work. To advance whatever your community's priorities are around addressing health problems.
So how? If I'm an alum, I hear this message, and I'm like, I have one of these problems in my communities, and I want to actively. Where do they go? What do they do?
First thing is look at our social media, because there are a lot of resources there already. And then for any one of those issues, you can reach out through our Alumni Association or honestly post a comment on our social media. And we can link you with the resources within the school. We've got a bunch of fact sheets that are up. We have centers that have really discrete resources for folks in their community. We have certificate programs for specific issues as well. So I would love to see the Yale alumni be ambassadors for creating change in their own communities.
That's awesome. I love it. That's a great way to end our more serious part of the conversation.
Okay.
Because we're going to dive into the questions now that everybody gets that can get actually more controversial than the bigger questions. Favorite spot on campus?
Beinecke.
Okay, why?
Oh my God, it is so gorgeous. It is like the coolest building ever.
Okay.
And I love how, I was actually in it the other day with a friend whose kid is a Yale undergrad.
Okay.
And she said to me that it is what a library should be. Instead of hiding the books in the stacks, it displays them like a jewel box, which is just so gorgeous. And I feel like it epitomizes Yale.
Yeah.
Right? It's like we have these incredible collections and we put them out for the entire world to be able to enjoy.
Yep.
And it enables us to think differently about science and humanism and history. And like, it just to me is
I love that.
One of those gorgeous, emblematic spaces that is only possible here.
It's very pure. Like there's something about that space when you walk up, it's like you go from, grass and cross campus, and then suddenly you're just like in this white marble building. Commons is in front of you and the Schwartzman Center. And my favorite is walking through that at night when it's like bottom lit and like the whole, it's got a real vibe about it.
Further, another reason I love it. So when I was there with my friend, we were talking, the way that the light comes through the marble, first of all, brilliant and so creative.
Yeah.
So we're standing kind of at the guard desk and said to the guard, "Oh, how thick is the marble?" And he's like, "Oh, here's a sample."
No,
right?
really?
He's got little squares that show just how thick the marble is, and you can hold it up to.
Okay.
I mean, like the fact that we thought of that.
Yeah.
The fact that we encourage curiosity and interaction with this space.
Yes.
I just think is awesome.
It is a good spot.
But if you ask me this in 5 or 6 years,
okay,
I will say the new building that we are planning.
Oh.
Our school is currently spread across 10 buildings across campus.
Oh, really?
And so we're in the process of planning a gorgeous new identity-defining building next to Yale Ventures, across the street from where psychology is, and Woosai, kind of down on College
down that
Street.
corridor, down like the corridor to the hospital. And
that's what I am anticipating my new favorite space will be.
Well, that's exciting. Yeah. That'll be something to look forward to. Do you have a favorite Yale memory? I know you haven't been here that long, but anything ingrained?
I'm going to be honest. I went to our competitor Up 95 as an
I know, I haven't mentioned
undergrad.
it. I wasn't going to.
But one of my favorite memories is now 2 years in a row watching Yale beat Harvard at the game.
Wow.
So I have become true blue, wearing my navy. And
I love it.
Yeah.
Is that hard? Was it a hard, no. I love that.
No, actually not at all. My friends who are Yaleys have always joked with me that I should have been.
I agree. You've got a real Yale spirit.
And I'm like, you weren't just, teasing me. It actually may be true.
It may be true.
So
I love a good convert.
Yeah.
Well, welcome to the team.
Thank you.
We're thrilled you're here. Do you have a favorite New Haven pizza place?
I love Sally's.
Okay.
My other new favorite is actually this place that is relatively, I think, new in New Haven called Zanelli's.
Yes.
It's more
Worcester Street.
Yeah, I think it's absolutely terrific, and the lines are not as long.
Yes. Worcester Street is just it is a gem.
It is.
But I like Zanelli's at the other end, opposite Pepe's and Sally's is a nice addition. Mm-hmm. All right. So people head to Zanelli's. Tell them Dean Ranney sent you.
Yeah.
All right. Last question for you. Is there one item you always have on your desk?
Ooh. I think I'm like most people. I always have pictures of my kids and my spouse. And I always have a mess on my desk.
Okay.
I think that that Einstein quote around kind of a clean desk versus a messy desk.
Yep.
I tell my husband and my folks that work with me that I am that a messy desk to me is a sign of a busy mind.
Okay. Fair. I don't have a messy desk, but the drawer, like, because I just kind of, I'm like that person that, like, as long as I don't see the mess, it's just it's packed away. But this has been a joy. I'm so glad we got to learn more about the School of Public Health. Alums, you've heard your task. Please get involved, become leaders in your community, and use the resources available to you that Dean Ranney is creating. So,
thank you.
Yeah, thanks for being here.
My pleasure. Thanks for having me. And can I just actually give you a shout out?
I love a good shout out.
Okay, I am so impressed and energized by your vision for this Alumni Association. I love the way in which it brings campus together.
Thank you.
I love the way that it creates space for all of our alums.
Yeah.
Again, to me, that is one of the beauties of Yale, and the ways in which you're doing it with thoughtfulness, with grace, with fun and energy. It's just been a pleasure to get to be part of it.
That's really, really kind of you. It's important that our GMP alums feel really welcome. It's actually, our GMP alums outnumber our Yale College alums for the first time. And Yale College is always, I'm Yale College. We're like, it's strong. We all bleed blue. But everything that we do at the YAA is for everyone. And I really hope that people will hear that message and feel a part of their regional club, their shared interest group, and partake in the knowledge and activities that are happening there.
It's awesome.
Yeah. Well, thank you so much.
Thank you.
This was wonderful.